All right, well, thank you, Dr. Gerber, for having me here to talk to everybody. I know I was supposed to get started 20 minutes ago to be done at 4:30. So I tailored my presentation because I knew I was going to be starting late, and I know you guys have been through a lot of information. Dr. Shakari's lecture was great with the details and with the supporting evidence and all that. So this is a different approach. This is not a how-to lecture in terms of how to do your bone grafts. This is, I'm not going to be putting up, all the supporting literature out there. Of course, if you guys need me, my email, I didn't put it up here, but my first and last name, calrammo @gmail.com, if you have any questions for me. But I'm going to keep this very simple, just cases, just going to hit on some like pearls and key points. When do we want to do this? I'm just going to keep it generalized, okay? Because I know you guys need to go home. I know it's kind of a long day, okay? So just a little bit briefly about myself. I came around full circle. I mean, I did my undergrad sciences in Toronto, and I'm back here now. But pretty much my clockwise journey, so to speak, started in Buffalo, New York. After my undergrad here, I went to dental school in Buffalo. I didn't experience this, which they did a few days ago, and I just thought this was just like unbelievable. But I endured this for 4 years. I had a great experience. Another picture. I mean, imagine opening your door and seeing that. I didn't get to that point, but I definitely had enough. So I was very lucky, and I got accepted to my surgical program in Miami, where our hospital is basically that first built. No, I'm just joking. Our hospital is kind of more in the inner city area, but I trained in Miami. I had a great time there, and as a Canadian, as you guys can imagine, especially after today's past week's weather, it was hard for me to come back directly. So this is in the early 2000s, and my journey, I decided to stay in the US. I practiced in Scottsdale, Arizona for a number of years, and finally, the past 6 years before coming back, I spent my career in Newport Beach. So don't feel too bad and too sorry for me, but home is here, and family brought me back to Toronto. So again, it's good to be back home. I think the past 15 years that I've been away, I think the weather has just been waiting for me. So I think we got one of the worst winters my first year back last year. So again, thank you for your attention. Pretty much, like I said, I'm going to break down the talk into just 4 cases. I'm going to just talk a little bit about different scenarios of bone grafting procedures, when they're indicated, what are the limitations, and then we can kind of cover a couple of graftless solutions. I know there's been a lot of things, and I'm trying to do my best to minimize overlap, because there's only so much I can say about treatment planning for the edentulous arch. The speakers before me did a great job. So I'm going to do my best not to reiterate things that we've already kind of heard today, okay? The last couple of points, just a few things that I've realized over the past couple of years, some hot topics just medically. Our patient who's the osteoporotic patient taking the bisphosphonates, just a few latest updates from this past year in terms of what new thing we know in terms of management. And, again, a new anticoagulated drug that's in the market, and just if you run across that with your patients, just some updated guidelines in terms of how do we take care of these patients. So again, I'm not going to go through this whole treatment planning setup that's been done today, but pretty much, what is my job? I'm part of the team with the restorative dentist, with the lab, the prosthodontist, whoever is going to be on board. I'm part of the team. They're going to do all their diagnostics. They're going to tell me, we're doing this kind of case